Now we will read the component part one by one in details. So here, first we will be reading about the retainer, the first component of your fixed partial denture. So you can see that this is your fixed partial denture, and here, which I'm coloring green, they are your retainer. Okay, so these are your retainer, and this retainer will get attached to these abutment teeth. So what is a retainer? Retainer is a part of FPD, that is a fixed partial denture, that is cemented to the abutment for the stabilization, or you can say it as retention of prosthesis. Okay, so what is a retainer? Retainer is a part of FPD that is cemented to the abutment for the stabilization or the retention of your prosthesis. So there are different types of retainers which can be fabricated for the fixed partial dentures. So they are being classified on the basis of the first one on the amount of tooth coverage. The second one on the basis of the mechanism of retention. And third on the basis of material used. Okay, so first on the basis of amount of tooth coverage, the second on the basis of retention, and the third on the basis of the material used. Now coming to the amount of tooth coverage, the fixed partial denture is being divided into three types. So they are the first one is your complete coverage retainer, or you can also call it as a full veneer retainer. The second one is your partial coverage, or you can call it as a partial veneer retainer. And the third one is your conservative retainer. So here you can see the different types of the retainer. First, here is a complete coverage retainer. So here you can see that in this complete coverage retainer covers all the surface of the teeth. All the 5 surface of the teeth are covered by the retainer. So what happened over here? So here you can say that it covers all the 5 surface of teeth. That is your abutment teeth. Okay, your abutment teeth. Okay, now this type of retainer provide maximum retention. It provide maximum retention. This is its advantage. Okay, and it is most widely used. Because it provides the maximum retention. That's why it is most widely used, and it can also be used for the extensively damaged abutment teeth. If the abutment teeth is extensively damaged abutment teeth, so it is ideal for extensively damaged abutment teeth. Now coming to the partial coverage retainer or partial veneer retainer. So in this type of the retainer, this retainer does not cover the whole surface of the abutment teeth. So here you can see this surface of the abutment teeth is not covered and they are partially covering. That's why it is called as your partial coverage retainer. Okay, so this type of retainer are called partial coverage retainer. So what happened over here? It do not. So here it do not cover all the surface of abutment teeth. Okay, therefore require less tooth preparation. So here you will get an advantage that you will have to prepare less tooth. Another advantage is that it will have a superior aesthetic. Disadvantage over here that it will have less retention. So it will somehow cover the partial crown, that is up to either 3/4 of the crown, or you can say that reverse 3/4 of the crown, reverse 3/4 of the crown, or sometimes it may cover your 4/5 of the crown, or your 7/8 of your crown. Okay, so these are the types of the coverage which is seen in the partial coverage retainer. So coming to the conservative retainer, this is the third type of the retainer which has been seen. They are generally seen in the anterior teeth. So they are present only in the anterior teeth because the load is less over this side because of the decrease in load factor. Okay, the only advantage is that it required a minimal tooth preparation. Okay, so it required a minimal tooth preparation, but the retention will be low. The retention will be low. So you can see here, you can see this is the anterior region of the oral cavity. Here, this is your central incisor and this is your canine, and the missing area over here, you can see this is your lateral incisors. Okay, so here the prosthesis have been made for the lateral incisors, and these two portion you can see over here, these two are your retainer. This will get attached to the abutment teeth. One will get attached to the central incisors and the another will get attached to the canine. So you can see here, one retainer is being attached to the abutment central incisor, another retainer is get attached to the abutment canine, and the lateral incisor, which is a pontic or you can say prosthetic, is been filling the space, edentulous space. So this is a conservative retainer.